close the door so there's some privacy. Hi, my name is Morgan. I'll be your nurse today. I will be doing a physical assessment on you. Do you have any questions about that?
No.
Alright, can you tell me your name and date of birth?
Andy Magyar, 21085.
Alright, check the band. That's accurate. Do you have any allergies?
Penicillin.
Alright, check the band again. That's accurate also. I'm gonna wash my hands and raise the bed up to a working height. I see that you are on 3 liters of oxygen nasal cannula. Make sure to document that in my vitals. Alright, so I'm gonna grab a set of vitals from you. Put that on your finger. Grab the temperature. Alright, 98.7. And I would check the respiratory rate for 1 full minute while he's distracted. Respirations are 16 for 1 full minute. O2 sats are 97. Pulse is about 80. Alright, blood pressure is 130/77. Are you experiencing any pain today?
A little, yeah.
Alright,
Yep.
Can you tell me where the pain is?
On my elbow.
Alright, which elbow?
This one.
Your right elbow?
Mm-hmm.
Can you describe that pain for me? Is it a burning, throbbing, stabbing?
Aching.
Is that aching pain? Alright, on a scale of 1 to 10, can you tell me, 10 being the worst pain, can you tell me how that rates?
A 2.
A 2? Is there anything I can do to ease that pain?
No.
Alright, no? Alright. Can you tell me where you are?
Rasmussen College.
Alright, can you tell me what time it is?
About 2.
Alright, and can you tell me why you're here?
To practice doing assessments.
Alright. Sounds good. I'm going to start my assessment. I'm going to lift up your head. I'm going to check the back of the head and the back of the neck, make sure all the skin is clean, dry, and intact. I'm going to check behind the ears, this ear, and I'm going to check behind this ear. And then I'm going to check his face. I'm going to check his forehead, his cheeks, his mouth, his eyes, under his nares, make sure everything is intact. Can you puff out your cheeks? Stick out your tongue. Alright, facial symmetry is good. Next, I'm going to take a listen at your heart, and I'm going to listen for 1 full minute at between the 5th intercostal space at the left midclavicular line. Alright, after listening for 1 full minute, the pulse is about 75, and then I'm also going to assess the skin on the chest to make sure everything is clean, dry, and intact, and there's no lesions, abrasions, or rashes. And next, I would also listen to make sure that it's a regular rhythm, which it was regular, and it was very strong. Next, I'm going to assess his lungs. I'm going to go in an S-shaped pattern. I'm going to listen for 1 full breath sound. Make sure to get the 7th sound on the right side. Alright, and I would check the skin over the lung area, make sure everything's clean, dry, and intact. Can I have you sit up? Alright, I'm going to assess the lung sounds on the back side also, going in an S pattern for 1 full breath sound. Assessing the 7th sound on the right side. And I'm going to check the skin on the back, make sure everything's clean, dry, and intact, there's no lesions. Alright, you can sit back. I was listening for the sounds to make sure everything was clear, which they were. I didn't hear any crackle, stridor, or wheezing. The lung sounds were both equal on both sides. Do you have any shortness of breath today?
No.
Alright, have you been using your incentive spirometer?
No.
Has anybody taught you about that yet?
Nope.
Alright, so since you're going to be laying down for quite some time here, it is important to use this to prevent like airway collapse and lung collapse and help promote the expansion of your lungs. So you're going to want to use this 10 times an hour while you're awake, and you're going to want to breathe in, not breathe out, and you're going to want to get this yellow piece up to the target zone, and you're going to want to keep it in this happy space. Can you demonstrate that for me?
Okay.
Alright, very good. And again, you're going to want to do that 10 times an hour. So a good time to do that would be between commercial breaks on the TV.
Okay.
Alright, and next I'm going to go down to the arms. I'm going to check both arms. Check all the skin on there, make sure everything's clean, dry, and intact. I'm going to feel radial pulses. Make sure that check if they're regular, irregular, they're strong. So they're strong and they're equal on both sides. Do you have any numbness or tingling in your hands?
No.
Alright, is that normal for you?
Yeah, it's normal.
Alright, check the elbows. I do notice one little scratch on the elbow down here, which is where he's having some pain. And then I'm going to check capillary refills on both hands. Check multiple fingers, make sure they're all under 3 seconds. Then I'm going to check and see if he has a PICC or IV line. And I'm going to check to see if it's clean, dry, and intact, and how old it is. If it's getting close to the 72-hour mark, I'm going to make sure that that's documented, that needs to be changed pretty soon. Right? And then next, I'm going to move down to the abdomen. And I'll lift up the gown here, so I'm looking at the bare skin. And I'm going to assess the area, make sure that the skin is clean, dry, and intact, and there's no abrasions, rashes, lesions. And then I'm going to listen to each quadrant for 1 full minute. Alright, I heard bowel sounds in all 4 quadrants. If I didn't hear bowel sounds, I would listen for 5 minutes in each quadrant. Then if I still didn't hear any, I would get a nurse in for a second opinion. And then I'm going to palpate each quadrant for any rigidity, distension, tenderness, pain. Are you feeling any tenderness or pain when I palpate?
No.
No? Alright, very good. Are you able to pass gas?
Mm-hmm.
Alright, when was your last bowel movement?
This morning.
Were you continent with that?
Yes.
Do you use a toilet or a bedpan?
Toilet.
A toilet? Do you have any nausea, vomiting, diarrhea, or constipation?
No.
Alright, very good. When was your last void?
This morning.
Alright, did you have any hesitancy, urgency, frequency, or pain with that?
No.
Alright, were you continent or incontinent with that?
Continent.
Do you have a catheter, or were you able to use the toilet?
Toilet.
Toilet, very good. Then I'm going to check the peri area, make sure everything is clean, dry, and intact, and then I'm going to check the buttock area. Can I have you roll to your right side here? Make sure you don't go on your arm. And make sure everything's clean, dry, and intact, which it is. Okay, you can roll back. Alright, everything's good there. I'm going to go down to the legs and assess the legs. And assess both legs, starting from the top and going all the way down. I'm going to check for edema. I don't know any edema, but if I did, I would give that, I'd rate that on a scale of a +1, 2, 3, or 4. And then I'm going to check for color, temperature, integrity, and moisture. I'm going to check capillary refills on multiple toes, make sure that they're less than 3 seconds. I'm going to assess the top of the foot, in between the toes, the bottom of the feet, and the heel. I'm going to do that on both feet. Alright. Again, there's no edema. And then I'm going to check pedal pulses on the top of both the feet. Make sure that see if they're strong or if they're regular or irregular, which I feel that they're very strong and they're regular and they're equal on both sides. If I wasn't able to feel the pulse on here, I make sure to use a Doppler. Alright. Do you have any numbness or tingling in your feet?
No.
Is that normal for you?
Mm-hmm.
Alright, everything looks good on your legs. Are you able to move around in bed by yourself?
Yes.
Are you able to get up and go to the bathroom by yourself?
Yes.
So when you're walking down the hallway, can you do that by yourself, or do you need assistance from others?
By myself.
Yourself? Alright. Do you use any assistive devices such as a walker or a cane?
No.
Alright, well that wraps up what I need to ask you for your assessment. I'm going to make sure the bed is back to its lowered height. I'm going to give you your call light. Make sure the room is free of clutter. Fill the water pitcher if you're not NPOs or anything else I can get for you.
No.
Alright, I'm going to wash my hands. Again, my name is Morgan. Be sure to let me know if you need anything, alright?
Okay.
Alright, and then I would exit the room.